Hi everyone, Dr. Chiam here from Ensoul Medical. Over the last few weeks, we've gotten a few inquiries about treatment of acne scars. We've got some potential patients who are asking us about carbon dioxide laser to treat their acne scars. And of course, they were a little bit puzzled when we told them that, hey, we at Ensoul Medical, we do not use the carbon dioxide laser to treat acne scars anymore. So, of course, this video is targeted at these patients so that we can address the reasons why we don't use the carbon dioxide laser anymore. So the carbon dioxide laser or CO2 laser is a laser that has been around for a while. I think it probably has been around for at least about 30 years. It used to be an ablative laser, meaning a laser that we use to burn off the entire surface of the skin and hoping that it regenerates well. Subsequently, laser companies came up with the fractional carbon dioxide laser. This laser produces less downtime, it doesn't take off the entire surface of the skin, and it's generally safer than the ablative lasers because it produces less scarring and less tissue damage. But we do find that the carbon dioxide laser in Asian skin types, it's still a little bit risky because the risk of developing pigmentation or PIH, post-inflammatory hyperpigmentation, can be as high as 80%. In patients with scarring issues, acne scarring or other types of scarring, we tend to need to push the power of the carbon dioxide laser high, and in order to get good enough tissue remodeling, in order to get good enough collagen stimulation. And we find that the risks of complications such as post-inflammatory hyperpigmentation, scarring, as well as skin infections goes up higher. For the longest time, the carbon dioxide laser was all we had, and the other lasers such as the Q-switch laser or the Erbium laser tended to be poorer alternatives to treating acne scars. So there are some newer technologies on the market that help us to achieve better results than the traditional Erbium lasers or Nd:YAG lasers, but yet at the same time maintain a good safety profile which is superior to the carbon dioxide laser. And these newer treatments also tend to have a more acceptable downtime compared to the carbon dioxide lasers. So the newer generation Erbium lasers with the newer handpieces allow us to stack pulses of Erbium laser. Traditionally, it's been thought that the Erbium laser does not penetrate quite as deep as the carbon dioxide laser. That is true if we use single-pulsed Erbium lasers compared to single-pulsed carbon dioxide lasers. The newer Erbium lasers allow us to be able to stack pulses of Erbium laser onto the skin, so it allows us basically to reach pretty much the same depth as the carbon dioxide laser when we are treating acne scars. So this allows us to treat acne scars with the Erbium laser with much less downtime and risk compared to the CO2 laser, but yet at the same time achieve the same depth. The problem with lasers in general is that they require multiple treatments. Some patients, in order to get good results with fractional lasers, need maybe 10 or even 15 or even more treatments. So each treatment comes with it a significant downtime. Most patients have redness and swelling for maybe a couple of days, and then they have peeling and scabbing of the skin for up to a week after that. So that is a problem for a lot of acne scar patients, and in the modern lifestyle, not many people are able to take a downtime of a week each time they do treatments. And if you take that over 10 to 15 treatments, that is a very, very significant time that you'll be living with a swollen and scabbing skin. So there are newer treatments now on the market for acne scars, and in our clinic we use the fractional radiofrequency as well as the needle radiofrequency to treat patients with acne scarring. So both the fractional as well as the needle radiofrequency work on the same principle. We use an applicator to pass an electric current into the skin, and we stimulate new collagen production as well as tissue remodeling with these methods. So the fractional radiofrequency in our clinic is called the Puro. We use the Puro to treat patients with scars such as rolling scars. These are scars that are very wide based and tend to disappear when we tense up the skin. Because the fractional radiofrequency goes from outside in, it emits radiofrequency energy from the outside to stimulate growth of new collagen in the skin. The needle radiofrequency treatment in our clinic is called the intensive, and we use the treatment to treat deeper scars such as box scars as well as ice pick scars. The intensive works on the principle of having insulated needles penetrate deep into the skin and emitting electric current or radiofrequency energy in the deeper dermis of the skin to stimulate regrowth of the collagen as well as shallowing of the scars. Generally, these two treatments have a lower downtime compared to a carbon dioxide laser. Most of the time you get about a couple of days of redness and swelling and about another 2 or 3 days of mild scabbing of the skin after the treatment. The amount of results and improvement that you can get with just one session of these radiofrequency devices is definitely more than what you get with one CO2 laser or one Erbium laser for that matter. And as a result, it provides the benefit of patients not having to go through so many treatments as well as suffer so many downtimes. So I've covered some of the treatments that we do in our clinic with regards to acne scars. Of course, the treatment that is most suitable for you will really depend on how much downtime you're able to take, as well as your previous experience with other devices, and also your type of scars that you have. So do feel free to drop in for us to have a discussion on which treatments are most suitable for your needs.